So I'd like to welcome Jane Whiffen and Liz Jones, who are some of the practice leads in the Centre of Expertise on Child Sexual Abuse. They've partnered with us through this journey and have been an enormous source of support and advice and guidance, really, as we've kind of learnt about ourselves and where we are in relation to our work on child sexual abuse and thinking about where we could get to and where we can be. So delighted to hand over to them.
Good morning, and how awful it is to see my photo up there. Thanks very much for that, Natalie. So yes, I'm Liz Jones. I'm one of the practice improvements advisors in the Centre of Expertise on Child Sexual Abuse, and it's really lovely to be with you this morning at this really important event. So just to say something about the Child Sexual Abuse Centre, if you haven't heard of us already, do look us up, do find our website. You'll find masses of information there about the work that we do and the resources that we have. We are a multidisciplinary team, as you'll see there, working closely with key partners from a whole range of organisations and institutions. And our overall aim is to identify, generate and share high quality evidence in order to tackle and prevent child sexual abuse and to improve the practice of all of us. I make no apologies for repeating this message about looking after ourselves, because whenever we talk about and think about child sexual abuse, we do need to be mindful of the possible impact of those thoughts and those conversations, not only on ourselves, but on others. So this morning, please do look after yourselves, do look after those around you, for those of you who are in the room this morning. So, what we're going to cover, I'm going to take you briefly through what we know about the scale and nature of child sexual abuse. And that's then going to lead us on to thinking briefly about how important it is that we understand signs and indicators of child sexual abuse in a holistic way, and why a different and, we believe, a more effective response by all of us is needed. Jane then is going to take us through the child sexual abuse response pathway, and will briefly introduce you to some of the resources which underpin the pathway. So, understanding the scale and nature of child sexual abuse. Right now, what we know is that the number of children who experience sexual abuse that services know about is just the tip of the iceberg. So a much smaller number, 103,000 approximately, child sexual abuse offences were recorded by the police in England and Wales. These are the most recent statistics from 2021, 2022. And then an even smaller number of child sexual abuse, of assessments carried out by Children's Social Care in England identified child sexual abuse as a risk factor. And then you'll see at the top a really small number of children end up being subject of child protection plans under that category of child sexual abuse. What that translates into is that we believe that more than 1 in 10 children have been sexually abused by the age of 16. That breaks down approximately into 15% of girls and 5% of boys. What we also know from crime surveys is that child sexual abuse is just as common, as you'll see here, just as common as physical abuse and emotional abuse. Yes, in assessments carried out by Children's Social Care, child sexual abuse makes up a far lower proportion of the factors which are identified as being risks to children, far lower proportion than factors relating to physical and emotional abuse. And then here's the pictorial image of child protection plans, which just show us what a low number of children are on plans under the category of sexual abuse when compared with the other categories, and specifically neglect. And hold on to that thought as I go on to the next slide. So we know that there are associations with other factors here. Disabled adults are twice as likely as non-disabled adults to say that they had been abused in their childhood. 1 in 4 of those who had lived in a care home reported experiences of child sexual abuse, so almost 4 times as many as those living with family or carers. And the likelihood of experiencing child sexual abuse doesn't vary significantly between ethnic groups in England, but we know that people from some minority ethnic groups face additional barriers to reporting abuse. And then there's a real crossover between child sexual abuse and neglect. So just think about that in relation to the vast number of children who are placed on child protection plans under the category of neglect as opposed to child sexual abuse. In 2020, there was a joint targeted area inspection, which was a deep dive inspection into assessment and intervention by statutory agencies into intrafamilial child sexual abuse. And one of their key findings was that professionals rely too heavily on children to verbally disclose. That was a key document, and their findings concur with research about the challenges that children face in telling professionals about abuse. This is quite a difficult graph, but it tells us from the Office of National Statistics that at the time of the abuse, children are extremely unlikely to tell. And if they do tell, they're likely to tell someone that they know. A key finding from a wide range of research is that amongst those many, many children who we don't reach, there are children who don't tell due to threats, due to shame, due to fear, due to guilt, due to a whole range of reasons. And then there are children who try to tell, but they're not heard. And then finally, there are children who are absolutely sure that they have told through their behaviour, through their presentation, but either no one's noticed or we've misinterpreted what they thought they were telling us. And so we need to think about signs and indicators in a different way and make a different and more effective response. We know that the evidence for child sexual abuse taking place is rarely clear-cut. There are some reasons. I don't have time to go through these. I'm just going to flag them up. Okay. You will recognise all of these as being examples of where we are more likely than not to know that child sexual abuse has taken place. But the reality is that rarely will we be in a position of absolutely knowing. So what we need to do is we need to look at the evidence that we do have, and we need to build a picture of concerns. So looking at the signs and indicators in the child, but not only the child, we also need to be thinking about what are the signs and indicators of sexually abusive behaviour that we might begin to consider in the person or persons of concern around the child. And then also think about what vulnerabilities there might be in the child's environment that increase the risk of child sexual abuse. So the signs and indicators template takes us through these 4 areas. thinking about the behaviour of the child or young person, any physical signs in the child, but also, as I say, just looking at behaviour of those around the child and considering any environmental signs. All of that, and the Signs and Indicators template is a really kind of solid research-based tool to help you consider what those signs and indicators might be. So pulling all that together, building that picture, can help us to notice, to find out more, and hopefully to respond more effectively. I spent some time introducing you to that resource because that is just one of the resources which the Child Sexual Abuse Response Pathway links you to and refers you to as you make your way through it. So now I'm going to hand over to Jane.
Thanks Liz. Ditto on the photograph. You couldn't have shocked me more, Becky. I must have done something terrible to you.
That's me.
Oh,
I'll take credit for that.
Okay. We haven't even met. We always met in this live.
Sorry.
So I'm going to take over from Liz. Liz and I didn't really introduce ourselves. We both have social work backgrounds, actually, and we work at the Centre of Expertise, but actually we've been doing some parts of this job for a very long time. We realised we've both had some significant milestone birthdays. I won't reveal what they were, but they were. I'm sharing that with you as well, Liz. So welcome everybody here and welcome to those online. And I'm going now. We said we had practiced the clicker and we didn't. So is that? Oh,
No, that's the other way.
that's right, the other way.
That's it. There you go.
So I'm going to talk to you about what the Child Sexual Abuse Response Pathway is. And we've got a very, very short period of time to do it in, understandably, because you've got so many interesting things to hear. So I'm going to run through it, but I really recommend that you spend time looking at it, going through it. It's been a 3-year journey, to be honest, and Michelle, who's here, who you'll hear from, she and I have been on this journey for a very long time, and at times it has felt quite an onerous journey, actually. Still feels a bit like that, actually. I always think the word pathway will forever in my life be a slight trigger warning about how much work there is to do about it. And quite simply put, it's a message of hope, a message of opportunity to be doing something really positive for children. Because 3 or 4 years ago we realised child sexual abuse as a kind of professional area of work had been really, really neglected. Kind of goes back to things like the Cleveland Inquiry, where professional networks have become really, really nervous about working in this space. So I'm a social worker, but I also do serious case reviews, and I see practice all the time where people are doing a really good job, but around child sexual abuse, there's a little bit of a nervousness. So we wanted to support busy practitioners. We recognise what a tough job it is, and we really, really hope that this does that job. So kind of how did we go about this 3-year journey? So we started with a scoping study. The Centre of Expertise is an evidence-informed organisation. It really tries to marry together the research knowledge, the practice knowledge, experts by experience knowledge, and build from that so that people can feel really, really confident about where some of this work has come from. So we've done a scoping study, and then we set up a reference group and tried to kind of map out a child's journey from the earliest points where we have concerns about the child being sexually abused, right the way through to police involvement, police investigation, child protection planning, and you'll see all that when I go through it in a minute. We then drafted the pathway map, and that was quite painful, wasn't it, Michelle? A lot of time was spent on that. And then you'll see that there are 38 documents embedded within the map. Those are the good practice guides. And we then had a lot of feedback. We sent it first to a number of different experts by experience groups. That's both adults, parents and children. And they gave us an enormous amount of feedback, which really had a profound influence on the content of that material. And then we had professional review and refinement. And as Becky says, we're piloting in this in 3 areas. And so the pilot areas, many of you on the call maybe, many of you in the room have made feedback, comments about the pathway. So what is it hoping to achieve? So at the top there, we're wanting to make sure that it centres the needs of the child here. One of the things we really noticed is that as a professional network, multi-agency network, we have relied far too heavily on children to tell us what is happening to them rather than us taking responsibility. So not relying on disclosures, as Liz said. So it centres on the needs of the child. We hope it builds on working together, so it's compliant with working together and all the existing guidance that you have, but it hopes to clarify professional actions and expectations at different response decision points. So when you go and look at it, you'll find some of the documents are quite long, actually, and we sort of make no apologies for that, because we realise that people's lives are really busy. That is really so we recognise that. But on the other hand, this is a complex area of work, and we want to make sure people understand some of the things that give you good advice, good guidance about what will support you in your different role. And we want to improve the professional response. We want that to take place. So when you see the map, there are sort of three bits to it. So the first bit is the pathway map. There are then the guidance, good practice guidance, and as Liz said, embedded through are a range of resources. When you think 3 years ago, none of these resources existed. It's quite incredible, actually, to think about the transformation of this practice landscape, both in terms of the documents and the resources. And one of the things that's a real headache when, like me, you're doing the revisions to the pathway, is people at the CSA Centre keep blinking writing new resources as if just to make more work for me. But it's amazing that we've got more and more resources to help you do that. And we're going to take you through those. So really important that we centred this on the rights of children, but also parents as partners in this process. Not forgetting the complexity of often we're talking about parents and adults who are protective factors and parents and adults who are harming factors. So that's something we've had to really think carefully about, and you'll see that we've done that within the pathway. We want to think about children's disability needs and make sure that children with disabilities have the same opportunity to access services, support, to be able to talk to adults, and we've focused quite a lot on that, given that we know that disabled children are at least 4 times more likely to be sexually abused than any other group. We focused on issues of sexuality, although the evidence base and the research base is very, very poor on this. We need more. Where it exists, we've included it. And we've also thought about culture and ethnicity. As Liz has said, we know that there are real barriers for children and their families from a black and minoritised community accessing services, being heard, feeling confident in professionals. And we've tried to speak about how to kind of help that, how to address that. We've also included socioeconomic circumstances. There's an emotional cost to having child sexual abuse impact your family, but there is also a socioeconomic cost, and we're living in the cost of greed crisis, as we know, and we need to be thinking about family socioeconomic circumstances. We also have tried to cover across the pathway not just intrafamilial child sexual abuse, and if we'd had time, we'd talk to you about some of the differences here between children who are harmed by adults and children who are harmed by other children, and we needed to take account of that. So we've got intrafamilial child sexual abuse, but we've also covered sibling sexual abuse. Some say that's probably the most common form of sexual abuse that we're all dealing with. Harmful sexual behaviours, child sexual exploitation. But with some of these, because, for example, around child sexual exploitation, there is already quite a lot of guidance out there, and probably true of harmful sexual behaviours. We've done quite a lot of signposting rather than repeat what you have in other places. Who's it for? I mean, that's a really difficult question to answer because it's for everybody. So this is for anybody who comes into contact with children at any point where you have concerns about their safety and well-being. So we encourage you in nurseries, in early help, in family support teams, any teachers, health visitors, anybody, police officers, when you start to make a list, you suddenly realise you're going to miss anybody out. So then you start to take those. And everybody else is included. So I didn't mention you, I was thinking about you, but it's for all of you. Now I'm going to try and get us onto the pathway. I'm slightly nervous about this.
You want to try it?
Give it a go. See, I'm even afraid of it. That's why I've moved back. Halfway makes me scared.
It is loading. We've just got the Wheel of Doom at the moment.
It's loading. Bear with, as they say.
Might just drag the internet window over to that screen. Over to the right.
If we can't do it, we have got a couple of slides that show it.
It won't let me click
It's
on
more
anything.
fun to see it in person.
It doesn't take much to get moved.
Is that a no?
Promising.
That
So
looks-
promising now.
Don't worry. I don't want us to take a lot of time.
Reload it that, see if it'll.
Yeah, clicking it down.
Click and die, click twice, right?
Let's give it one more.
Something's
go.
happening.
You might have it. Yay! I think that deserves a round of applause. And those real lines. So if you accept,
Yeah. I'm getting that. It's a bit tricky at this angle. Do you want me to scroll on anything?
yeah, I think you need to press on the sexual abuse response pathway. It doesn't quite look like the front page, does it?
I think we may have clapped too early.
I know. Just preemptive clap.
It's not. Let's move on. Yeah.
Okay, I will.
You'll get all these slides, and the link is in there. So have a look yourself. But I'm going to go back.
Sorry.
So the pathway starts with these, what are described in the notes as 3 blobs, purple I think, and there's a. So if we're in the pathway, you click on Introduction to the child sexual abuse response pathway, and there you get a document up which will tell you about the child sexual abuse response pathway, how to use it, all of that kind of thing. If you click on this next one, we have a whole load of quotes about what children want when they come into contact with services. So what does a child or young person who's been or is being or has been sexually abused need from us? And the third one is bringing together all the advice about respecting children's individual characteristics, their experiences, backgrounds, when responding to child sexual abuse. So that's where we think about disability culture, all of those kind of issues. Yeah. So, I'm now in charge. Yeah. So there are four entry points really. So the first entry point is when you have concerns that a child may be being sexually abused, but you actually don't know. And that is so very often the situation we're in, isn't it, as professionals? So you have concerns. So it's recognising what you might need to think about in that context. The next one is when a child comes to you as a professional and tells you that they are being sexually abused, because that's a very different context, isn't it? So how you respond is quite different at that point. The third point is this really, really important issue of how to respond when images of a child are found. Because actually in that situation, children won't know that we know about it, and it can come as a complete and utter shock to them. So we really wanted to think about what we need to do in that context, particularly in kind of some of these areas of blurred concepts of consent and sharing of images, particularly between young people. So there's quite a bit of advice and guidance there. And then the fourth one, which I guess you'll recognise all these things, is when a child, another person comes to you to tell you that someone they know is being sexually abused. So it's really, really common for children to tell their friends at school and then come and tell somebody else. And we're wanting to, we cover those 4 areas because we want to make sure this journey is as seamless as possible so that children don't have to tell their story time and time again. It's quite hard to see this, I can see from the slide, it's quite sort of blurry. So those are the 4 entry points, and this is the first page, which I was hoping would come up on the screen, and hoping that I could magically click on them and you'd see the documents. Can't do that. But on the left-hand side are what we call the 4 welfare documents. And the 4 welfare documents are around children's relationships, about their health and well-being, and their education and family relationships. And those 4 documents are for every part of the pathway. It's just a reminder. So if you have concerns a child's being sexually abused and you're wanting to make a referral to children's services, that's not the only thing you need to do. You need to be thinking about the child's welfare at the same time. So we're encouraging you to both alert other people to action, but continue to think about the child's welfare as you go. So we've covered how to make a referral, because we know that making referrals into children's services is, well, Becky will know this better than anybody, is crossing thresholds, is quite complicated. So we've given some advice about how to centre sexual abuse here as a concern. What you should do if that referral doesn't meet the threshold, we'll send you back to the welfare documents. Think about the child's needs, think about the family's needs. What can I do in these circumstances? How can I keep alert to what's happening to this child? Maybe build some more information. Maybe give children a better opportunity to speak about what's happening to them. And then the next page, and that is even more complicated, which is why you can see we wanted to do it online, is this is the pathway that children and families have to negotiate through their life when they come into contact with us as professionals. So again, it starts right at the top about, so the right-hand side is the police response pathway. Quite excited about that because although the role of the police is outlined in working together in quite minimal detail, it hasn't existed before. This is genuinely, I'm trying to whip up some enthusiasm. That's obviously failing massively, but this is genuinely new. For those of you who don't understand the complexities of an investigative process, what happens, how does all this take place, you go there, it will give you a sense of that. So this is the police pathway. On the left-hand side starts with early help and goes all the way through child in need planning, into child protection planning, child in need meetings, child protection conferences, and kind of takes you through what you need to be thinking about in all those different circumstances. Again, it doesn't replicate what working together tells you, but it does centre sexual abuse as an issue of concern, and it centres the child. So on I can't show you the documents because we can't go online. And this was Michelle's wizard idea, so I have to say it's her wizard idea, is that how the child is feeling is right at the front of every document. So we have quotes from children, from research to say, you know, what does it feel like when you subject to child in need plans? What does it feel like to have an early help plan? We as adults know what that looks like. Children don't always know what that looks like, and it doesn't always feel the same way as we hope it will feel. So there's quite a lot to be done there. Liz, how's my time going?
I was just going to do this.
I thought she might. See, I preempted that. I'm not going to go. The feedback's been brilliant. We've had loads of feedback from Bristol. I was very happy about it at first. Then I had to do all the work around it, so my happiness level went down. I've done it all now, so my happiness level is a little bit back up. But overall, this has been, people appreciate the work, feel it's helpful. I hope you all feel the same way, so that's the early feedback. So alongside the documents embedded are all these different resources. So we've got, Liz has already talked about the signs and indicators toolkit. We've got a communicating with children guide. The last review I did here in Bristol actually was the Becky Watts review. And I don't know if everybody knows who that was, but it was the young woman who was murdered by her stepbrother. And one of the big issues that came out of that review was that people didn't know how to talk to Becky about concerns about sexual abuse. It wasn't the major issue. but it was one of the issues. And I can remember talking to the school education service and various people about, Jane, we're just not sure what we can say. We worry about getting it wrong. So we've done a Communicating with Children guide to kind of thinking about how you approach children, but also what you can and can't say. So we've got Supporting Parents and Carers guide. It's a really helpful guide to help parents understand this complex area of child sexual abuse. And then we've got Safety Planning and Education. So we know that there are massive concerns about harmful sexual behaviours in the context of schools. And this is just a really practical guide. We've just got hot off the press, the Managing Risk and Trauma After Online Sexual Offending. So where an adult in a family is found to have downloaded either indecent images of children or sexual abuse material, what sense do you make of that in terms of both their parenting ability, their vulnerability, but also the vulnerability of children around them? We've got a sibling sexual abuse assessment guide coming sometime soon, and we've I'm not going to go through those, but we've got huge numbers of key messages from research coming out in the next. Well, we've done a few. We've got harmful sexual behaviours. We've got 2 coming out on technology-assisted harmful sexual behaviours. We've got a refresh of the intrafamilial child sexual abuse. These are quick, snappy updates of the research. So sign up to our newsletter, and then you can hear all about all the new resources that are coming out. And we've put at the end here, there are loads of organisations to support all of us in working. If we don't recognise the emotional impact of this work, we're not going to be as effective as we can be. So take time out and use some of these resources if you need to. Thanks very much.